Reproductive tract infections are identified in 3 classes, including endogenous infections that are as a result of an overgrowth of organisms normally present in reproductive areas, iatrogenic infections, which are due to medical procedures, and sexually transmitted infections. According to Dr. Hassan Mulema, the head clinical services at Makerere Hospital, the availability of this RTI system will go a long way in availing necessary health information to the public.
Then from there we had to develop a video that describes the RTIs, how they are spread, how they can be prevented, and how they can be managed. And it's what we are going to print right away.
Unfortunately, much of the data is not used, but in this digital era, Makerere University is leading in the use of data. And it is only data that is going to tell us more information. So I want to encourage my fellow citizens who are shying away from this data, saying that if we link it to our national ID, it is not going to be safe. This data is protected, and we can only develop as a country if we integrate this data and use it for our health, the health of our community, but also for their development. Some of these infections are extinct in some countries because they have utilized this data and been able to prevent them and even treat them immediately.
Digital transformation, but also the population is young. They are more digital oriented. So as a way of reinforcing or strengthening self-care, we want people to initiate care at individual level so that we don't delay anything. So
the doctors say about 80% of people living in Uganda are likely to benefit from the RTI health application.
This is actually meeting the need of our population. Actually, over 80% of our population, because we have the 78% that is below 30 years, but also those that are above 30 years are all utilizing this information. So what a better way to respond to societal needs.
It was noted that reproductive tract infections are very common among Ugandans, although only a small percentage care enough to know the causes.
We usually note that reproductive tract infections are not well understood, but also are a problem in the public. So it was just that background that made us write a concept that was shared with Makerere. The Makerere is Makerere Research and Innovation Fund, the funding that is given by government of Uganda to support research that is done at Makerere University.
The Makerere University Hospital's Reproductive Tract Infections app will be available for use to anyone who can access an Android smartphone. Mario Nawori for UBC.